is Alan Goldbloom. I'm President and CEO of Children's Hospitals and Clinics of Minnesota, and I appreciate the opportunity to give a voice to children in the healthcare discussion. We applaud Congress for working toward the goal of reform, but also would remind all of the lawmakers that no matter what we do on the coverage side, if we don't also address reimbursement levels, many patients are still going to find it hard to find the care and services that they need. Thus far, much of the debate has focused on Medicare. I'm going to focus a little more on Medicaid, which is the single largest insurer of children in our country. Throughout this country, children and the children's hospitals that treat them are especially vulnerable to the impact of inadequate Medicaid reimbursement. At our own organization, we served more than 42,000 children on Medicaid last year. Children's is the state's largest provider of care to children with complex medical and surgical conditions, and we're committed to turn no child away regardless of insurance status. But Medicaid represented 40% of our revenue last year. 6 years ago, it was 30% of our revenue. In most hospitals, it's much closer to 10% or even less. Yet Medicaid pays only 80% of the actual cost. So while the number of children relying on Medicaid insurance seems to increase each year, we've actually seen the reimbursement rates erode year by year, usually because of cuts at the state level. As the gap between cost, true cost, and reimbursement increases, our ability to provide necessary care is increasingly threatened. A lot of the reform debate has focused on the reimbursement rates for Medicare, which is coverage for our seniors. It's generally about 20 to 30% lower than private plans. The fact is that Medicaid rates are 30% lower than Medicare. Across the country, on average, Medicaid pays about 71% of the cost of care, and that's if you exclude the disproportionate share payments, which help. If you include those payments, it's up to 77%. So if we do expand coverage, but the rates continue to reimburse below the cost of care, then it will be harder to assure appropriate access. Here in Minnesota, we have an additional problem. And I speak not only for my own hospital, but for all of them. And I'm also the immediate past chair of the board of the Minnesota Hospital Association, so I'm aware of what our colleague hospitals are facing. The hospitals in our state have justly earned a reputation for providing some of the highest quality and lowest cost care in the nation. This has been alluded to already this morning. Our reimbursement rates are among the lowest. We are therefore extremely concerned about legislative proposals that would apply across-the-board cuts to existing rates without taking into account the value of care already being delivered. The simple message of such proposals to Minnesota appears to be, thanks for leading the nation in keeping costs down and providing the highest quality care, and as a reward for those efforts, we're going to cut your rates even further. If healthcare reform is going to ensure real access to healthcare for children, it must include provisions to set Medicaid reimbursements at a rate that is at least comparable to Medicare, and ideally would cover true costs of care. The America's Affordable Health Choice Act of 2009 does propose to increase primary care physician rates to 100% of Medicare by 2012, but that won't be sufficient. To ensure true access, Medicaid must reimburse the specialists and hospitals at this level as well. For the sickest children, such as the son of Melissa Winger, access to specialist care in children's hospitals is essential. We also need to protect disproportionate share payments to hospitals. These have helped expand access to care by closing the gap between Medicaid reimbursement and costs. If more people are covered, but the rates remain below cost, then the need for those disproportionate share payments will be even greater. I'll close by saying that the investment in children's health is an investment that makes a difference that lasts for 70 or 80 years, not only in productive lives, but in avoidance of long-term health costs. There's no other health expenditure that has that kind of return on investment. So the needs of children, in our view, must be front and center in the debate.